On August 31st, the Biden administration proposed a new rule to make it easier to apply for Medicaid. The rule is titled Strengthening the Medicaid, Children's Health Insurance Program, Basic Health Program Application, Eligibility Determination, Enrollment, and Renewal Processes. The proposed rule is scheduled to be published in the Federal Register on September 7th, 2022. And it builds off of some of President Biden's executive orders from January 2021 and April 2022, focused on strengthening Medicaid and access to affordable, quality health coverage. The administration says this rule, if finalized, would standardize common sense eligibility and enrollment processes, and they expect it would impact about 88 million Americans. The changes would streamline eligibility and enrollment, mostly to reduce red tape and administrative burdens. It would also overhaul Medicaid's enrollment process, establish more consistency across state programs, and make it easier for people to get and keep health coverage. In a little bit more detail, here are some examples of other changes in the rule. They would conduct renewals no more than once every 12 months. They would use pre-populated renewal forms. They would provide a minimum 90-day reconsideration period. This would be for after termination for failure to return information needed to redetermine eligibility. They would eliminate any required in-person interviews and limit requests to information on a change in circumstance to just information about that change. They also said they would establish specific guidelines for states to check available data first before they terminate eligibility for an individual if that person can't be reached due to returned mail. They also said they're going to require sufficient time for beneficiaries to provide documentation needed to retain enrollment, and they're also going to make some changes to ensure automatic enrollment of SSI recipients into QIMBY, the Qualified Medicare Beneficiary Group. So like they said, a lot of those changes are common sense changes. In a statement, the U.S. Department of Health and Human Services Secretary Becerra said Medicaid and the Children's Health Insurance Program provide essential health care to millions of families across the country, and we are making it easier to enroll children and others in health insurance and to maintain coverage. And he continues, with these steps, we're delivering on our promise to make high-quality health care more accessible and affordable for all Americans. The proposed rule, like we said, is scheduled to be published in the Federal Register on September 7th. There will then be a 60-day public comment period that closes right around November 7th, 2022. In the description below, we give you more information on that proposed rule and instructions on how to submit a public comment.